Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. I'm joined today by Dr. Lawrence Lowe, our Medical Officer of Health, and Regional Councilor Michael Palleschi. The first thing I wanted to mention today is I'm encouraged by the relief funding that was announced earlier today by the federal and provincial governments. Steve Clark, our Minister of Municipal Affairs, announced that the cities hardest hit by COVID-19 will be getting additional funding. And that's integral because our workers, our municipal workers, are on the front lines, from first responders to public health workers to transit operators. Many of them have taken on enhanced risk, and to be able to maintain their budgets to keep them safe through additional PPE, that Safe Start agreement was so important. I can tell you that Brampton will be receiving $27 million in relief in 2021 through the federal provincial Safe Restart agreement. And I'm proud to say that as we exit 2020, our city's finances are intact because of this support from our federal and provincial partners, and we're looking towards 2021. Our budget passed, and for the third consecutive time, there'll be no tax increase in Brampton. The last thing we wanted to do was to put an unnecessary burden on the backs of residents who have been hit so hard already during this pandemic. So that's good news for Brampton residents. I wanted to speak briefly about vaccines. I know I've heard some concerns from residents watching on television as vaccines rolled out in Ottawa and Toronto, areas that have not had the same positivity rate, have not been hit as hard as the city of Brampton. I want residents to be confident that the rollout is coming to Brampton very shortly. I've been assured by provincial officials that next week we're going to see the rollout of vaccines in Peel Region at Brampton Civic, and I know that immunization program is critical for vulnerable members of our community. And I'm heartened to hear from provincial officials. I spoke to the Premier directly that there'll be special attention paid to the areas that are currently under lockdown, like Brampton. And so I'm looking forward to those first vaccines being administered next week at Brampton Civic. It'll be a great day for our community, given how hard this pandemic has been. I wanted to share an update about bylaw enforcement. We continue to see a high level of compliance. You know, I was frustrated in the spring and summer when we had a number of social gatherings. I think one week we had about 100. You know, as the summer wound down, we continue to see a high level of compliance. This week there was only 5 charges under the mandatory face covering bylaw, 24 charges under the Reopening of Ontario Act, and there was only 3 separate social gatherings. So only 3 in a city of almost 700,000 shows that the public understands the severity and the seriousness of COVID-19. In terms of a testing update, Osler has now performed 314,649 COVID-19 tests across its sites. As the number of COVID-19 cases in Brampton continue to rise, Osler has seen a steady increase in the number of COVID-19 patients being admitted. And so our hospital capacity continues to be tested. Currently, there are 52 patients at Brampton Civic Hospital, and 15 of those patients are receiving care in ICU. So as we head into the holiday season, I want everyone to really be diligent and really listen to the advice of public health, because our hospital capacity is stretched, and we don't want to see any unnecessary pressure on a system that is already challenged. So for a public health update, it's my pleasure to welcome up Dr. Lawrence Lowe.
Thank you, Mr. Mayor, and good morning. As of this morning, Peel Public Health has investigated 21,063 cases of COVID-19 in Brampton, 1,620 are active, 19,307 are resolved, and 136 are deceased. The current weekly rate is 260 per 100,000, which is down from a high of 300, and test positivity is at 11.3%, down from 14% at high. After 3 weeks, it appears that gray lockdown measures have helped to start bring a plateau in our community. However, the risk in our community remains high. At Brampton Civic Hospital, there are now 80 patients with confirmed and suspect COVID-19 and 16 in intensive care, which is double what was seen at the beginning of December, with no signs of the surge letting up. Like the first wave, letting up now risks losing the sacrifices of the past month, those same sacrifices that have raised so much anxiety in the community. We must continue to stay at home as much as possible, to limit interactions outside our home for the most essential reasons with precautions of distancing and masking and getting tested. And we must make sure that we are getting tested and self-isolating if we are sick. This is especially important as the holidays approach and more available vaccines are on their way. We're about to enter a new phase of the pandemic, but this will take place in the new year. Remember that a vaccine does you no good if you haven't had it yet, and it is not the solution alone. So during this holiday season, the safest thing to do is to stay home and close out this difficult year with those that you already live with under the same roof, or with one other household if you live alone. See your other loved ones virtually and laugh at our strange circumstances. Make a New Year tradition. This year is not the year to be hosting or attending social gatherings. And frankly, we need to remember that this is an emergency. If this were an ice storm, we would not travel to other regions to Christmas shop, we would not hold parties, and we would not argue about what should be opened and closed. We'd cancel Christmas dinner, we'd cancel New Year's celebrations if the roads were unsafe. We'd stay home, and we'd stay out of the way of our first responders and our essential workers. This pandemic is no different. We need to do our part to keep everyone safe, especially our most vulnerable. In keeping everyone safe, we must also continue to address disparities and inequities that put our community at risk and drive transmission. I'm grateful that Peel Council last week, led by our 3 local mayors, unanimously passed a motion calling for paid sick days to be mandated in Ontario. Federal funds have driven increased admissions into our voluntary isolation centre, and discussions continue with community partners around where additional capacity might be deployed. With those partners, we also continue how we can expand and provide support to the community that has been impacted, continuing to expand our reach in their own languages and relevant to their own contexts. And with our provincial partners, we continue to enforce workplace precautions that limit spread in those settings. All of these are small steps towards reducing barriers to testing and self-isolation and reducing transmission to keep our vulnerable and ultimately all of us safe. But we must continue to pursue protections for temporary and agency workers, eviction protections to provide peace of mind, and of course, to provide more support to our businesses that are doing the right thing and staying closed. This holiday season allows us to remember just how important it is to do the right thing and look out for each other. So stay home, stay safe, and stay apart so that we can all reminisce about how unusual these times were in the years to come. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, for your ongoing dedication. One of the silver linings during the pandemic is we've seen an incredible amount of local generosity, people wanting to find ways to support the less vulnerable. I've seen the community rally together in very special ways. And one of those examples, Councillor Michael Palleschi is going to speak about today for a remarkable turkey drive that is currently underway in the city of Brampton. Welcome, Councillor Palleschi.
Thank you, Mayor Brown. So I've been working with a number of local businesses over the summer to do something special for people that have been hit hard during this pandemic, and a number of businesses have stepped up, and a couple in particular, Brampton Brick, employs many people in Brampton, and Give and Go Foods have stepped up with a generous donation of 1,500 turkeys to donate to people that are just having a difficult time right now, our local food banks. So I wanted to take this opportunity to thank them, and also thank the number of food banks that are out there doing the distributing to people in need, Regeneration, Knights Table, St. Louis Outreach, just to name a few. We're going to, at the City of Brampton, we're going to push out through social media the contact information for some of those food banks so that we can get everybody involved to see what they can do, what they can give back to the community. We're all struggling right now, and some of those, single moms. I was just talking to one the other day that had a extremely difficult story, and there's many of people out there that just need an extra helping hand and support. So I'm asking all of our residents to step up and help where they can. Thank you for the opportunity. Thank you. I'll pass it back to Mayor Brown.
Thank you, Councillor Palleschi, and that's great news that 1,500 turkeys will be delivered to families in need this week in Brampton as an early Christmas gift, an early holiday helping hand. I also wanted to update the community on a fun contest we're launching. We've tried to think of creative ways to celebrate the different events we have in our communities so children don't lose out on some of the special times of year. As you know, during Halloween, we had a contest for the best costumes, and we delivered to the winners a life-size chocolate bar. Well, to help keep the magic of Christmas during this holiday season, we are launching today, and this is a lot of fun. It's going to be a gingerbread house contest, and so for the best gingerbread houses in the city, if you share your photo, and it's going to be on social media how to do so starting today, the best gingerbreads houses are going to get prizes that includes gift cards from Toys R Us and some amazing treats from local bakeries. So get ready, Brampton, to see some incredible designs for gingerbread houses. I was blown away at some of the Halloween costumes, and I'm sure we're going to see some equally creative gingerbread houses. So stay tuned for that. And I hear that we're even going to have Santa Claus volunteer to deliver the prizes to the winners. I also want residents to know that there's been some changes to New Year's Eve. Of course, we can't have a traditional New Year's Eve ceremony. And so what we're doing is we're having a virtual celebration. I'm inviting everyone to ring in 2021 virtually with special performances by Brampton's own Hawaii Mighty and Tokyo Police Club. The show will start at 8 p.m., so be sure to tune in on the website. We're going to have a really interesting New Year's Eve program, and it's all available at brampton.ca/New Year's Eve. So we continue to be creative. We continue to adapt to make sure we can provide great content for the residents of Brampton on these special occasions. So stay safe, stay healthy, and on that note, I'm happy to take questions for myself or Dr. Lowe. We also have JP from our bylaw department here if there's any bylaw specific questions, and of course Councillor Palleschi in regards to the turkey drive. The first question is from Graham Frisk from the Brampton Guardian.
Good morning, Mr. Mayor. How's it going?
Good.
I guess my first question would be for you. I'm just curious, the numbers that were given today for the hospitalizations, they seem to be, Dr. Lowe gave a bit higher numbers and included suspected cases. I'm just curious, have you been including suspected cases in your counts over the previous weeks, just for comparison purposes?
No, the report that I have from Brampton Civic, from Osler, are for the confirmed cases, not the suspected cases. So I can tell you as of today, for the confirmed, there's 52 patients at Brampton Civic Hospital and 15 in ICU. And that's as recently as this morning.
Those don't include suspected cases.
No.
Okay, my follow-up would be for Dr. Lowe. I'm just curious, I'm kind of looking at the stats here, Dr. Lowe, about deaths compared to cases. In October, we had 5,100 cases in Peel region with 5 deaths. And so far this month, in December, there's 6,400 cases and 37 deaths. So I'm just curious why the death rate has gone up so much in comparison to the number of cases in the past couple months.
So, Graham, it's a really great question, and this is really speaking to the spillover effect that we're seeing. In the earlier part of the second wave, most of our positivity and spread was seen in the younger age groups, 20 to 29 and 30 to 39. regrettably, as I've mentioned in previous public representations, we are now seeing, despite our best efforts and despite all the precautions that have been taken, increasing outbreaks in long-term care homes. And unfortunately, many of those residents are succumbing. The reality is that we did learn from the first wave. We put huge precautions in place throughout the summer and into the fall. But precautions are not foolproof, and if you have community rates as high as ours are, the more you throw at your defenses and your walls, eventually something's going to make it through. And so that increase in deaths that you're seeing reflects the return of COVID-19 into some of our older age groups and senior settings, unfortunately. Thanks for the question.
Yeah, and Graham, on that, it really speaks to how dangerous the environment is in the long-term care settings. It's why we need those vaccines as soon as possible to protect our most vulnerable residents. This weekend, I made a statement about Faith Manor, where there's, as of this weekend, there were 66 resident cases of COVID-19, 42 staff cases of COVID-19, and 8 deaths. And it shows that in some of these long-term care settings, particularly the older homes, it's like a tinderbox where it can spread really, really quickly. And so it's one of the reasons I've amplified my request to the province to make sure that we have our long-term care workers get those vaccines as quickly as possible, given how precarious the situation is in Peel Region. Our next question is Nitin Chopra from Prime Asia TV.
Good morning, Mayor Brown, and good morning to all. My first question is to bylaw officer. Since Christmas, New Year, holiday season is coming up, do bylaw have any roadmap or any plan ready how they will stop the parties and gatherings? Also, do they have enough tools and officers to stop all this? Because previously we saw that rallies and everything, all the social gathering and traffic laws were violated. So what is the plan to stop these parties in the coming weeks?
It's a great question. We currently have our staff will be working throughout the holiday season to respond to COVID-related complaints as well as municipal complaints. We recently met with command staff from Peel Regional Police 21 Division and 22 Division, and we will be jointly working together to deal with COVID-related complaints. And our approach will be a zero-tolerance approach when it comes to private gatherings at residences or illegal gatherings. This is not the time to have private gatherings during the holiday season. As I said, we will be taking a zero-tolerance approach. This is going to be a challenging holiday season for enforcement, but we have a commitment from Peel Police as well as our enforcement officers to work together to deal with the COVID-related complaints that we're going to be facing.
I have a follow-up question from Dr. Lowe. Dr. Lowe, any idea by when a maximum of the Brampton or Peel region will be vaccinated by the end of 2021, or what is your assumption in this?
So thanks for the question, Nitin. At this point in time, that end of the immunization campaign is certainly fuzzier and not necessarily our primary focus. Our primary focus, as you know, right now is getting started in protecting our vulnerable long-term care home residents and our long-term care home workers as per the provincial directive. But the roadmap that we have from the federal government suggests that vaccines will hopefully be more widely available starting in the spring through the summer with an aim to try to achieve broader coverage of the community of the nation in Canada by late 2021. So certainly we'll see how that timeline pans out, and we at Peel Public Health stand ready together with our hospital partners and healthcare partners throughout the region of Peel to ensure that we do our part to bring that to reality here in our community. Thanks for the question.
Okay, our next question is Steve Picard from in Brampton.
Hi, thank you. Question is for Dr. Lowe. Have you been involved in discussions with the province concerning stricter lockdown measures in the weeks ahead?
So I think the answer to the question is we're in conversation with the lockdown measures being revisited as of December 21st. At this point in time, there are certainly a number of trends in our community that are, that provide some guarded optimism. Certainly, we have not seen our case counts exceed on the 7-day moving average around the 400 to 500 mark, and now we're 3 weeks in, which suggests that we are coming into a bit of a plateau. However, in respect of whether those will be renewed, how they'll be renewed, and what changes may be proposed, those are all subjects of active discussion for which I'm not able to provide any further update at this point in time.
Just to follow up, how do you feel at this point? Do you feel that there should be stricter measures, or at this point you're not sure?
Well, so Steve, I think I've made it very clear, both that at least in my remarks, I said letting up now and would probably result in increased contact, increased interactions, and potentially increased spread, especially concerning going into the holiday season. We do know, hopefully, with the dismissal of school at the end of the fall term, that will hopefully reduce potential contacts, and certainly looking at that and the role of the school break in continuing our efforts, that's another area that's being actively looked at. But I've also been very clear that what our region needs is really some additional supports for essential workers, certainly the paid sick days, income supports, eviction protections, and certainly worker protections for temporary contract and agency workers. Thanks very much.
Okay, and our last question is from the Pointer.
Hi there, good morning. My questions are for Dr. Lowe. So in a press conference last week, health officials said the lockdown has not been very effective, and cases among close contacts or those who reside in the same household have been increasing. I wanted to get your thoughts on this and how you think the second lockdown is going.
Thanks, Nida, for the question. On November 23rd, when we went into lockdown, we were reporting 400 to 500 cases a day. And 3 weeks later, we're now reporting roughly in that average, accounting for aberrations, 400 to 500 cases a day. So the lockdown has had an effect in halting the upward trajectory of our cases. We remember from the first wave, and I think all of us remember this, that it doesn't immediately start going down. It takes a couple incubation periods for chains of transmission to burn out, and for our ongoing case and contact management work to take effect. I am, like I said, hopeful that the school dismissal will continue to assist our efforts because that will reduce community interactions. And I'm also hopeful that people will take the advice to heart. I mean, this holiday season is really about staying within your home and you're celebrating with those that you already live with. Because the reality is that like any other natural disaster, if this was an ice storm, if this was a hurricane, you wouldn't be out and about in the community trying to have social gatherings or head to a restaurant in another town that might be in a different color.
Thank you. And just a quick follow-up. I know that, contact tracing, you guys had to pull back a little bit, and now that cases are plateauing, as you're saying, will Peel Public Health start contact tracing with everyone again instead of just essential workers?
So just to clarify, it hasn't just been essential workers, it's been schools have been prioritized, long-term care homes have been prioritized, all sorts of various settings that are deemed high risk, either due to transmission or due to exposure, have been the focus of our case management and contact tracing investigations. At this point in time, we will continue with our current processes as we continue to look at how we get into high transmission, targeted neighborhoods in working with community agencies, and certainly on some of the interventions such as isolation centers, workplace inspections, all those other pieces that we continue to also work on in addition to case management and contact tracing to reduce interactions and reduce spread. Thanks for the question.
Thank you, Dr. Lowe. This completes our weekly COVID-19 update. I want to thank everyone at the City of Brampton who's working so hard, and to all our residents who are doing their best to abide by the advice of public health. Stay safe, stay healthy, and happy holidays.